Okay, I just had a practice run. That didn't work out because I had my lens that I'm using set to autofocus and it kept focusing while I was kind of moving around and making a lot of noise. This vlog is in continuation of yesterday's. I'll be reading you the results of my scan. Before I start, I do want to note that I'm not a radiologist. I don't have any, I'm not trained in reading these. I'm not a doctor. I'm not a medical professional, and I can't give you any medical advice that you can rely on. Nor can I read these reliably. My doctor has to do that for me. So if I say words wrong, if I'm wrong about these results, I'm sorry. I'm reading these and interpreting them based on my last 7 years of cancer and reading my own scans, as well as having a doctor read them back to me. I think I have decent experience with my own experience. So let's dive into this and we'll get started. So this PET scan is being compared to a PET scan that was done on October 13th of 2016. So about 2.5 years ago, right after my transplant. So in the findings, we start with the head and neck. There's relatively symmetric physiologic brain activity. That's good. Physiologic is a good thing. It's normal. There is persistent irregularity and nodularity of the thyroid gland with an apparent dominant heterogeneous right thyroid nodule with mild metabolic activity. What metabolic activity means is that it's got uptake from the radiation. So there's stuff in there that's eating that's not physiologic or normal. There's malignant or metastatic disease within the right thyroid lobe that's not excluded. It's not included, but it's not excluded. So, as has been for the last 7 years, that this nodule in my thyroid gland has existed and slowly grown over time, it's still an unknown. No one has biopsied it or done anything with it or messed with it to tell me whether or not it is in fact more cancer, or if it's just a nodule that just wants to exist in my body for whatever reason. Apparently, I'm a nice host. And yes, I have brought this up with many doctors. I have had, I think, 2 thyroid ultrasounds. No one wants to do anything about it. So I'll take that as a good thing. In my thorax, so what we're going to be talking about now is my lungs, essentially. There are innumerable small nodular densities scattered throughout the lung fields bilaterally. So both lungs, and innumerable, meaning they can't sit down and really count them because there's so many. The good thing is that they're all sub-centimeter, so they're all only up to like 9 millimeters, which is still fairly big, but still under a centimeter. However, I've had 2 that have grown notably on this scan and are showing metabolic activity, particularly one that's now 10 millimeters by 8 millimeters in the left lung, and it used to be 2 separate nodules, so it's gotten confluent. It's grown together. That worries me a little bit because that's what my liver nodules did. They were all fairly decent in size, and then they all started to grow together and become one giant monster of a tumor. So that's a little worrying to me, but it's still only 10 by 8 millimeters. There has been likely mild to moderate overall progression in the number and or size and extent of this patient's lung nodules. Another additional example of this progression is a right lower lung nodule that was previously about 4 or 5 millimeters and is now 7 millimeters. So it's grown by 3 or 2 millimeters. Ultimately, these findings are consistent with extremely extensive, widespread, mild to moderately progressive bilateral pulmonary metastases. I love that word, metastases. And that's it for my lungs. Continued growth, as always. That's unsurprising to me because this is always constantly what it's doing. Constantly growing, even if it's just millimeters. in a year. Still, it's still growing. In my abdomen and pelvis, there's persistent midline anterior abdominal pelvic wall surgical wound with a tiny fat-containing periumbilical hernia. So I have a little umbilical hernia that's filled with fat. I thought that little guy was funny. It's little. I'm not gonna worry about it because it's not cancerous. It's just a surgical wound that developed a hernia. There's physiologic urinary radiotracer excretion with small non-obstructing calculi within the renal collecting systems bilaterally. That is a long fancy way of saying my kidneys look fine, but I have some small non-obstructing kidney stones, which I'm not surprised by with my history of poor water drinking habits, which I have gotten a lot better about this year. I'm proud of myself. It's still not a lot of water, but I'm proud of myself. There is a subtle irregularity of the left lateral renal cortex. It may reflect a complex cyst. I personally know that what this scan is talking about is, in fact, a complex cyst because that's how it's shown up for the last 7 years of scans. That cyst has always been there. There's evidence that a cyst on my right kidney is what actually made me go to the hospital in the first place in 2012, which led to my hospitalization and diagnosis. So, it's always been there, and I'll know if it pops, because that shit hurt. In the musculoskeletal region, we're going to be talking about my spine now. This is the part that worried me the most, and with reason. So, there's scattered lytic or mixed lytic skeletal lesions that are particularly apparent within the thoracolumbar spine. Particular note is made of a 19 by 19 millimeter lytic lesion within the right posterior L1 vertebral body. 19 by 19 millimeters is 1.9 by 1.9 centimeters, which is almost 2 centimeters in size in its whole body. If you've never met me, I'm a tiny person. I'm 5 foot tall and I'm 120 pounds. 2 centimeters by 2 centimeters in my little spinal area is kind of big in my head. It may not look that way on the scan, but it's kind of scary. It was previously 12 millimeters by 13 millimeters, so it was just over a centimeter in size last year. Yeah. There are other vertebral lesions that are less prominent metabolically, but they are enlarged from prior study, including a 16 by 10 millimeter lesion within the left T5 or T6 vertebrae. He couldn't quite tell which vertebrae it was in the scan. That's okay. It was previously 13 by 8 millimeters in size. There is a 11 by 9 millimeter lesion within my right posterior sacrum. It was previously absent, or so tiny that it was too subtle to read. So in 2.5 years, that's shown up. That's new. There are scattered other areas of skeletal disease involvement, particularly within the pelvic skeleton, left glenoid, and left humerus. I don't think the left glenoid is new because it's right in the same area that another one was noted that I think it was just being called a lytic lesion under a different name, but it's in the same area. So either that or the old one went away and then the glenoid one showed up, as well as in my left humerus. So those are new. Ultimately, these findings are consistent with extensive skeletal metastases that are partially treated and or of limited FDG avidity. I'm not sure what FDG avidity is. Maybe I'll look that up and put that in here. They've never been partially treated. They could just be doing things on their own. And overall, the skeletal metastatic disease appears mild to moderately progressive from the patient's prior PET scan in 2016. So that kind of is confusing, but that's okay. Most of this is. So that's it. That's the scan. That's everything. Again, I'm not a doctor. I can't read these professionally. I can only tell you what I think is happening based on the scans and what the paper is literally telling me. And what that paper is telling me is that there is progressive metastatic activity in my body. It's unfortunate, and I'm disappointed with the results, but what I'm hoping comes of it is that these will be taken to the radiation board at the hospital that I go to, and that board will decide to do targeted radiation on the spine lesions, because my spine is what I'm most worried about, I think, with reason. There have been other EHE patients with bone lesions that they've done targeted radiation to and killed those lesions. So I would like to kill my lesions, my tumors. I would like to kill my tumors with this radiation, and I know it wouldn't be fun. I know that people can really suffer from it. I know that with enough radiation you can get different cancer and die. Hell, I had that happen to somebody that I know. So, with that, thank you for following me on this journey. I will update you with the next thing that happens, whether or not that's news on what's happening with the radiation board or the MRI that I was supposed to get that will now be happening on the 16th of this month. Either way, I appreciate you being here. I appreciate all of your love and support, and just keep an eye out for the vlogs. This isn't the only thing that I vlog. I do other things too. Let's just hope. Let's hope that they don't decide to put me on the wait and watch program, because wait and watch is what got me to needing a transplant in the first place and leads so many of us down a shitty path. I love you all. Thank you for being here.